Health literacy, the ability to obtain, understand, and use health information to make appropriate health decisions, is concerningly low in the United States. Nearly half of American adults have difficulty understanding and using health information. Low health literacy is associated with worse health outcomes, higher hospitalization rates, and greater healthcare costs. AI has enormous potential to address this problem through personalized explanations, plain language translation, and adaptive communication. The technology can assess a user's health literacy level through their questions and responses, then adjust explanation complexity accordingly. Someone with advanced health knowledge gets detailed scientific information. Someone with limited health literacy gets simple analogies and step-by-step explanations. The translation into plain language is particularly valuable. Medical jargon is a major barrier to health literacy. When doctors or medical documents use technical terms without explanation, patients often nod along without understanding. AI can take complex medical information and translate it into accessible language on demand. You can upload a test result or discharge instruction and ask for explanation in simple terms. This immediate translation removes a significant barrier to understanding. Language translation is another crucial capability. For the millions of Americans whose first language isn't English, AI can provide health information in their preferred language, dramatically expanding access to health education. This is especially important for immigrant communities who face both language barriers and often limited access to culturally competent healthcare. However, realizing this potential requires careful implementation and oversight. AI models must be rigorously audited for accuracy across diverse cultural contexts and health topics. Health literacy is not just about vocabulary level, it's about cultural frameworks for understanding health and illness. Information that makes sense in one cultural context might be confusing or offensive in another. AI trained primarily on English-language medical literature might not effectively communicate health concepts in culturally appropriate ways for diverse populations. There's also the accuracy challenge. Simplifying medical information can introduce errors if not done carefully. The system might omit crucial nuances or oversimplify to the point of providing misleading information. Bias in training data is another serious concern. If AI is trained primarily on health information that reflects majority culture perspectives and standard American English, it may be less effective for marginalized communities. Health disparities are already severe. If AI health literacy tools work well for educated native English speakers but poorly for others, we could actually widen health literacy gaps rather than narrowing them. Auditing must specifically assess performance across different demographic groups, literacy levels, and cultural backgrounds. When disparities are found, they must be addressed through improved training data and model adjustments. Policy support is essential for widespread impact. Public AI literacy programs could teach people how to effectively use AI tools for health information, helping them ask good questions and evaluate information critically. Integration of verified AI tools into school health education could improve health literacy from an early age. Community health education programs in libraries, community centers, and places of worship could provide access to AI health tools for populations without home internet access. Partnerships with community health workers could combine AI information access with human support and cultural competency. Verification and certification of health education AI tools would provide quality assurance. Not all AI systems are equal in accuracy or appropriateness. A certification process, perhaps through public health agencies, could identify which tools meet standards for accuracy, cultural competence, accessibility, and privacy protection. This helps users know which tools to trust and creates market incentives for developers to prioritize quality. The medical and public health communities should be involved in defining standards and evaluation criteria. The goal isn't to replace human health education, but to supplement and extend it. Doctors, nurses, health educators, and community health workers will always be essential for nuanced explanation, cultural sensitivity, and individualized guidance. AI can help by providing preliminary information, answering basic questions, and freeing up human educators to focus on complex or sensitive issues that require human judgment and empathy. The combination of AI tools and human support is likely more effective than either alone. If we can successfully deploy AI to improve health literacy, the impacts could be profound: better patient decision-making, improved chronic disease management, reduced healthcare costs, and ultimately better population health outcomes.